Now we're going live now.
Okay, that's
All right. Good morning, good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabinto, CEO and co-founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. I am excited today to have with us the one and the only Dr. Ike Emereuwaonu. Now I'm going to. Did I do a good
yeah.
job?
I think that was a good try. That was a good one.
Thank you, thank you, thank you. Not only is Dr. Ike a friend and a colleague of mine, but he is a man that wears many hats. And today we'll be talking about the topic, Doc, I'm pregnant. Now what?
Mm,
Dr. Ike, thank you so much for coming. How are you?
thank you very much. Thank you very much. I am Dr. Ike Emereuwaonu, and I know it's uh, it's actually challenging to pronounce my name sometimes, but I've lived with it for many years. So, and friends and colleagues just call me Dr. Ike because it's much easier.
Yeah.
Yeah, I'm a family physician in Memphis, Tennessee. I practice at Beloved Medical Cordova. You can look us up online when you get the chance. I also did advanced training in obstetrics, surgical obstetrics, and also certification in ultrasound, which also helps me. So basically, with that kind of training, being a family physician, I take care of the family, mom, children, grandpa, grandma, and those who are pregnant, and even taking care of pregnant ladies. I also take care of the babies in the hospital. So there's what we'll call a mother-baby unit, meaning what happens to the baby it affects the mother. What happens to the mother affects the baby. So I could take care of both of them. I feel it's a better model of healthcare because it's more efficient.
Mm,
The moms love it that they can bring their babies with them to clinic, and I get to start with one patient and end up with two patients at the end. That's just natural growth without any
mhm,
advertisement. It's
mhm.
just wonderful. So yeah, so that's what I do. I do a lot of family care. So I take care of everybody in the family, and we can organize mom, dad, two kids in one appointment, and they all come in one car in one
Mhm.
time and one location.
So
It's
you
just it's just
cost
wonderful.
savings, cost savings
Yeah,
for
I
the
mean,
family as
it
well.
saves their time. They don't have to take out from work twice to go to
Right,
two different
right.
places. They don't have to get in two different cars. They don't have to have two different schedules. Everybody comes, gets seen, and mama can tell me about. And let me tell you the best part. When when the husband and wife or partners come in, I
Right.
just love it when the wife tells on the husband. I'll say, "Hey, do you smoke?" "Oh, just a little." The wife looks at me and says, two packs of
Yeah, I
cigarette.
love couple visits.
that,
It's
that,
how on
that
each
that is
other.
the best, man. Because I just sit down and keep quiet, and they are telling on each other, and I kind of
Mhm,
like get the full story. Like
mhm.
it's just excellent. But anyway, so I love what I do, and yeah, that's exactly that's just a little bit about me right there.
I can tell that you love what you do, and I'm sure those who are watching live, hashtag live, and then replay, hashtag replay, can attest to that as well. Now, other facts about Dr. Ike that he did not mention is that
Okay.
he's an adjunct faculty at the University of Tennessee Family Medicine Department
Department. Yeah.
in Meharry Medical College and an associate program director of the Medical's Obstetrics Fellowship Program.
Yeah.
He has served for 5 years as an officer in the Memphis Shelby County chapter of the Tennessee Academy of Family Physician and the representative for District 10 to Tennessee Academy of Family Physicians. And he was elected Tennessee Family Physician of the Year in 2021. Congrats, Doc.
Thank you.
That's big.
Thank you
That's
very
big.
much.
Now, real quick, before we go into the questions, why do you do what you do?
Well, I don't know. I mean, I've thought about this. I mean, you've been asked this question multiple times
Yeah,
throughout
yeah,
your
you
life,
did. Yeah.
But if I can remember, I remember when I was like, was it 6 or 7 years old? Like I was feeling bad. I used to have a lot of like sore throat, tonsillitis, stuff like that. My
Mm,
mom would take me to the doc. And it used to be fine. I would listen to my mom talk to the doc about me. You know how you sit down, two people are
right,
talking about you, and you're like,
right.
these
You're
guys
right
are
there.
talking about me. What's going on here? And so a lot of times we'll go, my mom will get some medicine, give me medicine, 2-3 days, I'll feel better. After I start saying, I think I want to do this. I think I want to make people feel better. I'm telling you, the earliest I can remember, 7 years old, So I guess that's where it all started. And then for obstetrics, the thing about obstetrics is it's the one time where you take care of two people at the same time. There's no other, even there's no other area of medicine where you take care of two people at the same time. So every time I'm writing something from the mom, I'm thinking about, is this gonna be okay for the baby? I need to think about the two of them. Even in delivery, you're thinking about how is mom doing, how is baby doing. That's what's gonna decide. So that I loved that whole it was, would I say something special? Yeah, special. Pregnancy is special. And one of the first things I heard, in medical school was that pregnancy is not a disease. It's a physiologic state, And that I was like, that's true. Actually, we do need people to be pregnant to keep the human race alive. It's not a disease, So some of these things just intrigue me. And I love talking with pregnant patients. And, by and large, most times when people get pregnant, it's a joyous thing. There's sometimes when, it's not as joyful because of circumstances, but a lot of times it is. So it's a high reward area where as long as baby is fine, mama is fine, everybody's happy with you, everybody is celebrating. So those are some of the things that kind of keep me going. Yeah.
Awesome. I like the fact that you can impact two people at the same time.
Exactly.
That seems to resonate with you. Now that segue, because you said something, that segues into my first question. What do you say to the person who's like, oh my God, there's another human being growing inside of me? Whoa. So I'm pregnant, and they're like, oh my gosh.
Kind of like trying to find their bearing.
And it's not necessarily a sad thing, it's just like the realization, like,
overwhelmed. Yeah.
I'm responsible for growing another human being. What do you say to that person, real quick, to kind of
it's a miracle.
Yeah.
It's a miracle. Think about it. It's a miracle. And again, depending, like I said, I've come across people who are not as happy being pregnant, but I try to be sensitive a little bit. But the by and large, congratulations is always in play, Unless I know there are some really extenuating circumstances, then try to be sensitive to the patient and not be too this thing. But that's number one. Then number two is they can't wait to get their ultrasound. Oh, I'm like, how would you like to see the baby? And I have an ultrasound, machine in the office. So we just go to the next room, depending on how far along she is. Sometimes it's too early. And then we just show, and then they want to see the heartbeat. So I always will do a video clip for them. Now with technology, I can send it to their phone. And so there was one mom I saw recently. I said, you know what, before you go to bed, just look at your baby's heartbeat. Look at your baby's heartbeat and then go to bed. It's just wonderful. So yeah, congratulations. I say it's a miracle. It's just a miracle.
Beautiful. Yeah. I love that. I love how you give them something to kind of meditate on as they go to sleep. The heartbeat. Okay. Now, so for someone who's newly pregnant, they're like, yay, doc, okay. All right, I'm excited. It's a miracle. They have questions. One of the first questions I usually get is, okay, so doc, I'm taking these medicines. Can I take Tylenol for my back pain? Can I take ibuprofen for the headache I get sometimes? I feel like, no, I can't take anything, or, I have to be careful what I put in my body. What do you say, generally speaking?
I try to go through all the common medicines, that are over the counter. There are common classifications. Okay. As a general rule, plain is better than combination. So I tell my patients that anything that has a funny letter after it or funky 2 or 3 words, stay away from it. So for example, if you want to do a cough, just do Robitussin. Don't do Robitussin DM, AC, PC, PM, DT. Okay. Forget those letters. Just plain Robitussin is fine for cough. For pain, just do Tylenol. Tylenol is okay. Stay away from Motrin and naproxen and all those other stuff. Okay. If you're having allergies, most of the allergy medicines are fine. Don't do the combination one. Don't do stuff that has ephedrine. Most of these things that have PM or have something with it, they are more than one component, and sometimes you don't
Mm.
know what the second component is. So Claritin is fine, Allegra is fine, Zyrtec is fine, things like that. And then if you have nasal congestion or something like that, just nasal spray. Flonase is okay, nasal spray, things like that. And another thing is, if you're feeling nauseous, okay, and you don't have a prescription for nausea medicine, get over-the-counter vitamin B6.
Mm.
Vitamin B6 is really good for nausea over the counter. That's one of the things a lot of patients don't know, that your vitamin B6 works for
Mm-hmm.
nausea. So yeah.
Mm-hmm. Awesome, awesome. Now, I just want to give this disclaimer that these are medical suggestions, okay, not medical advice. So it's important to make an appointment with your own doctor and go to Tennessee and see Dr. Ike. So come up with an individualized plan for you. So that's really important. But I love it. Plain is better than combination, and it's important to review the medications you're taking, including herbs, and vitamins with your doctor on a one-on-one basis. All right, next question. Prenatal vitamins. There's so many options.
Yeah.
Generally speaking, someone's like, I want to give the best to my baby. What are things I should look for? What would you say, Doc?
Okay, so what I will let you know is prenatal vitamins are not as complicated as a lot of people might think. There are two main things you want to make sure is in your prenatal vitamins. Number one is folic acid.
Mm-hmm.
You want to have folic acid in your prenatal vitamins. Number two is you want to have iron in your prenatal vitamins. Pretty much everything else is negotiable. So most of the common prenatal vitamins over the counter fulfill this criteria. I mean, so again, generic is just as good as brand name if they have these two components that I'm talking about. I know people who have problems with being able to swallow some prenatal vitamins because they are too big. They
The
rather
cough
want the
pills,
chewable
man.
one. Yeah, they are big pills.
I don't know whose idea that was for
I
pregnant
don't
women.
know. Maybe they're trying to put in so many things into the vitamin tablet that they have to make it big. I don't know why, but I've had patients have that problem. They can't swallow their vitamin. They're already feeling nauseous. Why is this so big? Blah blah blah. So two options I give them. One, you can break the pill in half. It still works. Just get a pill cutter, cut it in half, swallow it twice. Another option is if at another option if you really can't do the official prenatal vitamins, you can use some of the chewable vitamins. And I'm just refraining from using brand names, but you can do some of those like Flintstones possibly. You could do
They
that.
have gummies now. They have prenatal
Yes, they
gummies.
have gummies. Yeah, they have gummies, prenatal vitamins. So you could do those. So remember, they are chewable ones. You do not have to swallow everything. So
Okay.
that would be my advice to them on that.
What are your thoughts on DHA?
DHA is okay. DHA is fine. I wouldn't, if you can't afford one with DHA or you don't have one available, don't knock yourself over. Don't knock yourself over. The minimum requirements is the folic acid and the iron pills. Sincerely, yeah.
Okay. Now, next question, Doc. I exercise. Is it safe to exercise? Generally speaking, Doc, what would you say?
Yeah, I think exercise is really good, and I think it's important for well-being. Exercise does a lot of things for you. The only thing I would say is adapt the exercise to what trimester you are in. How far along you are in the pregnancy. In the first trimester, you could do a little bit more. You can walk. Walking is always a nice thing. 30 minutes in a day. You could do some something like what will I say, stretching
Right.
exercises you can do on the mat, stretching exercises. You can actually do exercise bike and just kind of roll along. You know how some of these bikes have programmable
Settings.
interfaces that tell you how many miles you've been able to ride and terrain and all those things. Yes, so exercise is important. As you go along, let's say you're in the third trimester, now you're like people will say you're a little bit heavier with the baby and all that. You probably want to do a little bit less. Still, walking is always a good one, but you probably don't want to do up to 30 minutes, maybe 5-10 minutes just to keep yourself active. And stretching is also good. Yes. So overall, I would say exercise is acceptable. Actually, it's good for your overall health. Yeah.
The one thing I'll add though is that if you haven't been doing a certain level of intensity before you got pregnant, don't start it now.
Yeah,
Um,
exactly.
I mean,
And even if you want to start, do graded ones.
Graded,
So
yeah.
first day you do like 5 minutes, next day push 7 minutes, things like that. Yeah.
All right. I have a quick question. So we talk about cat litter.
Hmm.
I've had people bring that up.
Hmm.
What's for those who are watching, what's the big deal, Doc? Why can't I touch my cat? Like, what's up with that?
Okay, that's good. Yeah. Okay. Now, okay. So in the cat litter, there's a risk or a chance that you might come in contact with toxoplasmosis. Okay,
On
toxoplasmosis is it's an infection that can that the human beings can get from their animals. The thing with it now, and I want us to listen carefully so we understand, you can't get it directly from your cat. So if you hold your cat or pet your cat, you can't get it directly from cat. It goes through the cat poop.
poop.
Okay, and it takes about 1 to 5 days to become infective. Okay, so the advice is this: if you can get someone to change the cat litter and clean it up and all that, then do that. That's the safest way. If you can't, maybe you live alone with your cat or whatever the situation is, then you need to get gloves, wear gloves, change out the cat litter daily, because the idea is that if you change it out daily, the poop would not have stayed there long enough to become infectious to you. So the tendency is less. And then you wash your hands very well afterwards and use your hand sanitizers. And then so you take off your glove, wash your hands very well afterwards. So now the problem is, if you get infected with toxoplasmosis, it can go through the placenta and affect the baby and can cause congenital malformations and problems for the baby. Yeah. Which, yeah, there's not much we can do about it once it's happened. That's the thing. So it's better to stay away from cat litter if you can. But if not, then what I've just said, you can do that. Yes.
Awesome. So we're not saying get rid of your cats.
No, 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 we're not. We're just saying take precautions. Yeah.
All right. Awesome. Awesome. Next question. Generally speaking, foods. So
Mhm.
first trimester, let's do first trimester. Usually,
Okay.
the nausea. What would you say generally speaking? Like, Doc, what can I eat? What can I not eat? I want to make sure my baby grows well.
Yeah.
What would you say?
I would say generally eating a balanced diet, healthy diet is still obtains. I mean, it's still the right thing to do. However, I know that everybody's first trimester is different.
Right.
Two principles I use is, if you are having a lot of nausea, then one, eat things that are a little bit more bland than spicy or having a lot of
Flavor.
taste to it. Number two is find something that you do good with. So do a lot of trials. So
Mm,
if you have like 5 different foods at home, hey, I don't like that. Hey, I don't like that. Hey, I don't like that. But okay, I can do well with that one. Then kind of like do more of that. It's gonna be a case by case, person by person basis. Yeah. But still do your best to eat a balanced, healthy diet. Yeah. Now, as your trimester progresses, and that's another thing, because I just had a patient who had what we call hyperemesis gravidarum, which is excessive throwing up to the point that you have to put in the hospital, IV
right.
fluids, stuff like that.
Right.
And we were concerned. She got pregnant again. We were concerned this is going to happen again. So ahead of the curve, I gave her 2 different kinds of nausea medicine. One to use during the day, one to use at night. Just to try to get her on top of it. And so for her, the encouragement I gave her, she was like 12 weeks, 13 weeks. I said, this is the worst in the first trimester, which is about 13, 14 weeks, depending on who you ask. So just hang in there for like 1 or 2 more weeks. Okay. Just hang in there 1 or 2 more weeks, it will get better. And that's the encouragement I'll give anyone who has a really difficult
Time.
first 13 weeks. Yeah. Hang in there, just fight for your baby for like 2 weeks, 3 weeks more, and you'll be fine. Yeah.
It gets better. It does get better with time most of the time. And I love how you emphasize it. The goal is to eat a balanced diet, but the goal also is to make sure you have adequate intake for the baby's
Yes,
growth. So
exactly.
whatever you can eat, of course, within reason, you know, is 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 good. It's better than none. So
Nothing.
that's
Yeah.
that's key.
Better than nothing. Yeah.
Next question we're gonna ask is, are there foods to avoid? Are there drinks to avoid? Are there things to avoid?
Okay. Rule of thumb: avoid anything that's raw meat kind of, and raw fish. I think that's a real, yeah, raw fish. And even among fish, there's a concern about mercury levels in some fish. The principle is the larger the fish, the higher the mercury level. And that's because the larger the fish, the higher it is in the food chain. And the bigger fishes eat a lot of smaller fish. And so as you go up the food chain, the mercury concentration increases. So so you want to stay with, so first rule of thumb, because principles are important so that everybody can apply it to their situation. First rule of thumb, avoid raw, eat cooked, especially meat and fish. Second principle, even when you eat fish, try to eat the smaller fish. So I'm talking about tuna. Eat like tuna. We're talking about eat like, things like shrimp, smaller. So you can't eat seafood, but you got to be very, very careful about it. Um, then, what was the other part of your question again?
It was more things and drinks to avoid.
Yes, drink. So generally, right now, there is no level of alcohol that has been determined to be safe. No level. So some people say, I'm just going to take a sip. Well, no one knows if a sip is going to harm the baby, and no one knows if it's going to be okay for the baby. So the advice is take no alcohol while you're pregnant, because alcohol can cross the placenta and affect the baby. It can result in what we call fetal alcohol syndrome, which affects babies' mental development, facial features, things like that. So please, please, please do your best. Again, like I tell some moms, I say, fight for your baby. Fight yourself. Sometimes if you're used to drinking a lot of alcohol, just hold off for 9 months and let's have a healthy baby. So yeah.
Awesome, awesome. And of course, also smoking is something that we
Definitely,
we
definitely
definitely
smoking.
encourage to
Yeah, and
not.
if I may add, all kinds. Okay, because sometimes I ask people, "Do you smoke?" Oh no. Okay. Do you use any recreational drug? Oh yeah, marijuana. Oh, I smoke marijuana. That's okay. I know it's not cigarette, but that's smoking
not
too. It goes to your lungs. So yeah, vaping, marijuana, and cigarette smoking, cigars. Yeah, not good for pregnancy. Yes.
Awesome, awesome, awesome. This has been very rich. I have to say, I share your enthusiasm for being the first person or first interaction to be after the news. You're
Yes.
pregnant, and then you get to
Yes.
go over these and ask questions. And for those who are watching, it's really important to have a doctor you can sit with and ask these questions, and have a well informed pregnancy plan.
It's true.
And one tip I would say is that have your questions ready. I had these questions ready based on interactions with patients, but have questions that you have for your doctor ready, so that way when you go see them, you have it outlined and you can address. Now,
Yeah.
Dr. Ike, I really, really appreciate you for coming. I love the way you break it down. And I have people who are watching who are like, huh, I did hear him say has a practice in Memphis, Tennessee. Is that correct? Doc,
Yes.
where
Yes.
can people find you to connect with you, either to have you come speak on their platform or to connect with you as their primary care provider, pregnant or not?
All right, so we are in the Memphis area. To be exact, Cordova. Cordova is one of the cities around Memphis. It's 8045 Club Parkway, Cordova, Tennessee 38016. The name of the practice is Beloved Medical, and we've been around. We're going on to about 2 years now in the area. And you can call us at 901-249-0847. You can actually look us up. Belovedmedical.com is our website, and then Beloved Medical for Facebook, and also Beloved Medical for Instagram. I think we'll post all these after
Yeah,
after
they've
now.
been posted already.
Oh, excellent,
Yeah.
excellent, excellent. So just look us up. We love people, we love God, we love the people of God. We go above and beyond to try to help people have a healthy life. And our philosophy is that people are not just physical; they are
Mm,
also emotional. They are also spiritual. They are. We believe in holistic approach to care.
mm,
Um, if someone's spirit is uplifted, you
mm.
know, their health improves.
The body follows suit.
I'm telling you, we just believe that, and and that's our philosophy. That's just our philosophy. So a lot of times when I talk with patients, I listen to what they're saying, then I listen to what their heart is saying. You know, you listen twice. It's called listening twice. You know, it's a wonderful place. I just invite you to come and check us out, and we'll work with you to get you where you need to be.
Awesome, awesome. I really love what you do. Love the energy you also present, and love the spiritual aspect that you offer to your patients, because that's truly wholesome care.
Some care. Exactly.
Yes, yes, yes. Thank you all for watching. I appreciate you spending this Thursday morning with us live. I cannot see your names at this time, but I appreciate you. I will ask this favor. Please share this with someone who could use this. Be a blessing. Pass it forward. And if you or anyone or anyone you know is looking for an awesome, a passionate, and a thorough family physician in the Mansfield, Texas, not Tennessee area, then you can look me up. I am Steve. Dr. Ike,
Yeah,
thank you
look
so
her
much.
up. I
This
agree.
was
Look her
awesome.
up.
Bye, everyone.
All right. Take care, everybody. Bye bye.